Tuberculosis is caused by Mycobacterium TB. So from the name bacterium, so you understand that it's a bacterial infection. It can affect the chest, but actually it can also affect other organs, but primarily the chest. And so that's why it comes with the cough, which is the basic, most presenting complaint. So I think most word on the street is TB is a spiritual thing. It's an attack, and sorry to say, but the pastors don't even help these things, and then they keep praying and praying over and over again, and there really is no cure until the last resort is the hospital. Some other thing might be that it's a hereditary disease, a family disease, especially if you have history of somebody in your family has a asthmatic cough or bronchitis, as the case may be. So people will just link it to that and would not bother to go and check. Third thing on my mind is smoking. So anybody smoking and coughing, you just assume, okay, he's smoking, but it could be that, and it also could be TB. So why not just go and check it out? So
they believe that TB is a disease of the old. Yes, TB has been there for the old, but TB is still with us. They believe that there's no TB, but now TB is being with us. And just that TB is not just disease of the lungs. There are other parts of the body that TB can affect. Some people believe that maybe it's the disease that it is witchcraft or something because people cough blood and everything. It is because the lung function has been damaged. That's why that person is coughing out blood.
It's also believed that it is something for the poor and the society, but the truth is that it can affect anybody. Nobody's really immune to it, so we have to also take preventive measures to ensure that we are not affected by it.
It is not hereditary. It is just that because it is airborne disease. If somebody in the family has TB, there is tendency, if prevention is not, if there's no treatment for the person that have it first, there's tendency that the other person in the family will have it, but it is not hereditary.
Some of the early signs of TB include cough, persistent cough for over 2 weeks in a regular individual. We also have drenching night sweat and then weight loss. Those are core signs. And in people living with HIV, cough that is persistent, any cough at all, we would suspect, because we know that people living with HIV are more prone to what we call opportunistic infections. So things like TB, we call them husband and wife in HIV. So wherever you see HIV, there's a probability that any cough, the first thing on our mind is TB.
For people that are immunosuppressed, talk of HIV, we don't say 2 weeks of cough, we say week of that. If you notice that your client is coughing, you want to let this client have gene experts done and chest x-ray. Gene expert actually is the gold standard for tuberculosis testing, which show us resistance if there's any rifampicin resistance of the medication.
However, for the general public, a cough of more than 2 weeks duration should get checked. In our facilities and the community facilities where we operate across the 6 states where we are implementing our Care One project. So if the person is suspect for TB, the person comes, and if he can produce sputum, we go ahead and collect sputum for gene expert, right? It goes through a test, and we know. We also, which is a more current intervention, we have chest x-ray, and not just the traditional fixed x-ray. We have the mobile chest x-ray, which we take around communities, and we're able to use this to check people on the spot. So people are not willing to come into the facilities with us, irrespective of where you are. We're able to set up, and we're able to screen, we're able to check you on the spot.
What Care One is doing is to reach out to the community. We don't just stay in the facility. We go to the community and we do what we call active case finding. We are looking for TB for the people in the community, interland, people in hard to reach communities. Those are the things that Heartland Alliance is doing. We go with our PDS machine. Take for instance, PDS machine is portable digital X-ray machine with AI component. The moment we do the chest X-ray, it tells us immediately if this person is having TB or not.
So yes, TB is curable, tuberculosis is curable. There are drugs for TB and they are gotten for free from any government hospital and from our community facilities. So yes, when you are screened for TB, you're tested for it. And if you happen to be TB positive, please come, there are drugs for it.
Yes, tuberculosis is curable. Gone are the days where a client will need to be on treatment for like 2 years, 18 months, or 12 months. Now, the practical, clinical, classical treatment for TB is for 6 months. Patients be on medication for 6 months. The first course is 2 months, then followed by another 4 months of another course of medication. Those are the basic classic treatment for TB. For extrapulmonary TB, which is TB that is not affecting the lungs, or drug-resistant TB, that will take longer. That one can take up to 12 months.
Here in Care One, we always preach integrated service, right? So integrated service, systems-based approach. The important thing is, while TB should not be treated as a standalone, right? Because we are looking at the whole continuum of care and being holistic for every client. Once anybody comes and the person is triaged by a nurse, we screen regularly for TB.
Okay, for us to start preventing TB, it is one, if you are in crowded environment, ensure that you are using face masks.
Then there's something called tracing, contact tracing, which is very important, and people overlook that. Once a person is identified as having TB, we need to know the people living with the person, around the family, the co-workers, all of those people need to be screened. And if the opportunity presents itself, yes, also needs to be given preventive therapy.
Wash your hand regularly, and when somebody is coughing, if you want to cough, there's a cough etiquette whereby when you cough, you use your elbow to cover your nose. Prevent crowded environments, eat good food, eat very well, nutritious food.
Right, BCG does it at birth, gets the children immunized. It helps to also prevent TB, meningitis in children. So beyond that, beyond preventive therapy for children, especially for TB in children under 5, which is something that we do not talk about, it's very difficult to pick, or it's something that is out there in the community, and we actively screen for that whenever we see children. We should keep preaching immunization. Vaccinate your child. BCG is the way forward to prevent TB in children.
We say is yes, we can end TB. Powered by Federal Ministry of Health and Social Work and led by the community. The community need to come out to support so that we can end TB. With the community coming out, doing the needful, I'm sure TB will be a thing of the past.
Yes, we can end TB. It's been said that TB is a disease of the poor, and we know that the living conditions in Nigeria are suboptimal. So in as much as some of these things cannot change immediately, the best thing we can do is, wherever you're staying, make sure it's well ventilated, well aerated, and if you know or you have somebody that has been coughing, advise the person to walk into a facility nearest to him or her and get checked. And yes, we can